Hi, everyone. It's Dr. Jacqueline Cortez Sammons here at Transformation Health and Wellness in Anaheim Hills, California. Welcome to Wellness Wednesdays. I'm glad you're here. If you can join us. Today, we're going to talk about a little more serious topic. I know we've been talking a lot about, different supplements and things you can do. We're going to get into that definitely, but I definitely want to talk about some things that have hit my practice pretty heavily this week, actually. Today, I just met with a patient, and she was actually my third patient to share that she'd had a death of a very close family friend this morning from stroke. There was another patient who lost her father over the weekend, very, very sad, and another patient yesterday, actually, who lost his uncle. We always say in medicine, these things happen in threes. And certainly I told my patient this morning, I'm like, well, you're the third one this week. But what really concerns me is really the fact that as we're going through this whole COVID crisis, is everybody's trying to do the very best they can. They're hunkering down, we're sheltering in place, we're staying on our own, we're isolating ourselves, doing all these things, right? I think we're sort of looking the other direction from the fact that there are a multitude of other disease processes that are going on the planet than just COVID, many of which actually make COVID numbers of deaths pale in comparison to the vast number of people who can be really affected by these other disease processes. What do I mean? So right now, if you look at the top 10 causes of death based on the CDC website for 2018, 2019, influenza and pneumonia actually rank 8th in the likelihood of, death from this cause. Even if you added to that number, so that was at about, I want to say, I wrote it down. I'm a numbers girl, so I like my research. So influenza deaths were about 55,000 last year. They're estimated to be anywhere from 24 to 62,000 this year. That's deaths from diagnosed influenza and or pneumonia from other causes. Now, if we add to that the deaths from COVID, which is around 62,000, gets us up to about 120,000. That's substantial. Now, again, this is not to belittle any one death. Obviously, any death is a very, very critical thing. It's something that we should mourn and respect. Absolutely. But if we're looking at sheer numbers, right, that puts us up to 120,000. If we add influenza as a totally separate process from COVID, let's put them both together, it's about 120, 122,000. Okay. That would still only bring us up to the 1, 2, 3, 4, 5, 6th leading cause of death, just right around the same numbers of Alzheimer's dementia. And so what am I saying with this? It's absolutely not to belittle the gravity or the seriousness of COVID. And again, there's a lot of argument back and forth. Well, more people die of heart disease. Heart disease is still the number one killer of people in the United States. Hands down, absolutely. And it's confounded by a number of other factors like diabetes, obesity, smoking, hypertension, arguably cholesterol. We can get into that in another lecture. But certainly heart disease. And then the argument back to me is, well, yeah, but heart disease isn't something that's contagious. That's not something you can catch from somebody else. Cancer isn't something you can catch from somebody else. So that's not certainly something that we can compare to COVID deaths. Yes, you're absolutely right. Those things are not contagious. Unless, again, arguably you want to get into cervical cancer and its contagion and how it's caused and all of this. Again, another topic for another day. That being said, how is this COVID crisis really affecting these other types of issues? And I will tell you, one, we are isolating our elderly. We're not talking with them. We're not social with them. We're not able to hug and touch. We're very social beings by nature. So just the sheer fact that we're walling ourselves off, we're kind of putting them in a bubble, is not benefiting them from an immune standpoint. It really, truly is not. They're more susceptible to things like influenza and other infections. They're more susceptible to do poorly then if they do get infected with something or another. And they don't recover as well. So we already know this. This is studies, guys. This is something that is not, I just make it up out of my head, right? This is absolutely real. So again, while we want to protect that population, absolutely, it's a very slippery slope, because at what point then are we harming their mental health state, which then also plays into how their health state is. That also said, because we've been just scared out of our minds, right? People aren't going to the doctor. A lot of the doctor's offices are closed because the doctors themselves are scared. Their staff is scared. They don't want to have this encounter or this risk. So cardiology offices are closed. Pulmonology offices are closed. I just had a patient who needed an outpatient neuro workup and she couldn't get it because neurology offices are closed. Okay. So this is a big effect. And what's happening is you have people running around on hypertension medications and now they're not being monitored. People who are running around on Coumadin, which is a blood thinner, they're not being monitored. They're not wanting to go to the lab and expose themselves in the lab. The labs are busy running COVID screens, so they don't have time to run those other things. They do, but again, it's that perception that they don't, right? You have people on thyroid medications who are not being managed or monitored. Thyroid issues can kill you. It is not a little thing of like, oh, I just want to lose some weight. I need to fix my thyroid. No, there are people with thyroids that are way overactive and out of control. That can cause heart issues. It can cause heart attack. It can cause stroke. It can cause things like thyroid storm. These are all real issues. Again, not that COVID isn't, but these are all real issues and illnesses that are sort of being pushed into the back wings of everything while we focus on this one new novel disease process. And while this new novel disease process is important, we need to remember that there are these other things. We need to support our population who need their medications for their heart disease, for their high blood pressure, for their diabetes. Oh my gosh, don't talk to me about diabetes. Diabetes is number 7. So again, just above influenza and pneumonia causes. It's about 83,000 deaths per year. That's diabetes by itself, right? But then let's look at the bigger picture. Is that stroke is in there? Stroke is number 5, right? Heart disease, number 1, exacerbated by diabetes. Stroke, number 5, exacerbated by diabetes. Diabetes itself, and then renal issues. Renal disease, being on dialysis, that sort of thing is also something that is number 9 on our list of the top 10 causes of death. So all of those things are confounded by diabetes. So really, if you wanted to add all of those numbers, diabetes by far and away is going to be a number 1 killer of Americans. Absolutely. And again, what are we doing? We're all sitting at home. We're eating our feels. Right? We're eating our emotion. I even had my 12-year-old tell me the other day, as they see her sneaking upstairs with her little thing of ice cream, she's like, Mom, I'm eating my feels. I miss my friends. She doesn't feel good. She doesn't know what to do with her emotions. So we're eating them. I've had patient after patient after patient in the last few weeks tell me how much more they are drinking alcohol. And again, it's not to say that they're turning into alcoholics, but it's one manner that people do use to cope. Again, getting into the broader picture of things, we have this essential business, that essential business. What's an essential business? Liquor stores. So people have free and fair access to their alcohol and they are utilizing it. Drug consumption is up. Marijuana, CBD, the use of that has been very much up in my practice. I've seen it. Smoking from stress, which again, I always argue about because smoking is a stimulant, tobacco is a stimulant. So if you're needing to calm down, generally having a cigarette is not the way to do it. If you're feeling poorly, again, alcohol is a depressant. Drinking alcohol is not the way to fix your depression. That being said, we all cope in a manner of different ways. And just looking at the raw numbers of just my itty bitty practice, right? I have a very small practice, and just seeing the numbers there of the individuals who are really significantly affected by just isolation, by loss of job, by spouse loss of job, by having their kids at home and having to monitor their kids' homework. Oh my goodness, like on 16 different forums, we're going through Google Docs and Classroom and this and that and the other thing. It's a very challenging job, particularly when those parents also oftentimes have their full-time jobs. So it's not like it's, oh, I just get to be a stay-at-home teacher. Isn't this great? That in itself is a huge, huge undertaking, right? And my hat's off to all the teachers out there and all the people who homeschool their kids. You guys are rock stars. I love you. But when you are also combining that with a full-time executive job, ordering supplies, you're, navigating Zoom meetings, you're doing all of these other things while you have the fourth grader in the background going, I don't understand my math homework. And then you can't help them with math homework because the math is now a new math and you have to do it right. This is a challenge, right? So again, I've had a number of patients, even within my small practice, requiring anxiety medications, depression medications. Those also will lead to weight gain, which leads to more depression. It leads to obesity, which leads to heart disease, which leads to diabetes. Are you catching on? Are you seeing this trend, right? So this is what is happening to us as a population right now, and it's something that we need to be very aware of. I see we have a couple of things. Overall wellness seems to have taken a backseat to the COVID prevention. And again, I joke that it's the COVID-19 that we're all going to catch is the 19 pounds we're going to catch because of just sitting on our couches watching Netflix, series. Tiger King aside, right? I'll give you a pass on that one because it seems pretty riveting. I haven't seen it. My kids keep telling me about it. But that being said, I mean, this is a prime opportunity for you. And that's really, I don't want to be doom and gloom today. Again, you can look up the numbers on the CDC website. Feel free to fact check me all day long. I never mind that. I absolutely want you to. I want you to educate yourself. What I want to do more is empower you. I want to tell you how much you do have control over your own health state, right? So even though we are on home lockdown, it doesn't mean you can't go in your backyard and catch some rays, right? Get your own vitamin D. It doesn't mean that you can't go for a walk around your neighborhood. I have seen more neighbors in the past 6 weeks just coming home because I'm here in the office all day. I come home and I just see my neighbors walking around the block, and they're in couples, or small families, like, 2 adults and a couple of kids running around on their bikes, and they're getting out and they're walking their dogs. These things are still acceptable. So without, again, getting into the controversy and the protests, I don't want to make this a political post by any means. It's really about just getting out, getting that fresh air, filling your lungs, moving your body, feeling your muscles. Take this time to meditate, even if it's first thing in the morning, taking some deep breaths. My kids and I talk oftentimes about what's called box breathing, or what we term box breathing, which is where you take a deep breath in for 3 seconds, hold it for 3 seconds, breathe out for 3 seconds, hold it out for 3 seconds. Do that 5 times in the morning, first thing when you wake up. Do it 5 times before going to bed. That's all it takes. A lot of times we have said over and over again that we don't have time for a detox. I don't have time for that diet plan. I don't have time to meal prep. I can't think about that right now. I don't have time to go to the gym. Well, now you can't go to the gym, right? But again, it doesn't mean you can't walk around your block. It doesn't mean that you can't take some space in your kitchen and do 15 burpees every day, right? So all my physical fitness people out there, you absolutely can partake. A lot of gyms are streaming their workouts. So again, if you watched our Field Trip Friday last week was about Jazzercise, they're doing a live stream. You can access these workouts. So now it's a matter of prioritizing. What is going to be a priority to you now? Is it going to be doom and gloom and moping and I can't believe this and so forth, right? Or is it going to be proactive and protective? Exercise, endorphin release, serotonin, gabapentin. Exercise helps you to understand what is day and what is night. Because again, a lot of my patients are coming to me like, I can't sleep. I couldn't sleep initially just because I couldn't imagine all this is going on. I have so much anxiety about it and so forth. Now they're not sleeping because their bodies don't know the difference between day and night. We're under artificial lights all day long, no activity. So our body's like, I don't know, it's 3 o'clock in the afternoon. I guess, should I take a nap? Right? So we can help that out by doing some form of exercise during the day. And again, that doesn't have to cost any money. So even if you've lost your job, unfortunate as that may be, it doesn't cost you money to do burpees in your front living room, right? Or do a few sit-ups, crunches, do some squats. Get your body, your blood flow moving. That will bring oxygen to your tissues, which is nourishing, and it will pull toxins away from those tissues, which is healing. So it's going to help you with healing any kind of joint issues, brain fog, depression, anxiety. It helps with all of those things. So from a standpoint of not just I'm going to get skinny and fit and have a 6-pack, right? I always promise myself I'm going to get a huge tattoo on the side of my abs if I ever have a 6-pack. So you can guarantee that will never happen, and that's okay. But I want to be my best, most fit me. So even if that's not bikini model status, I'm going to feel comfortable in my own skin. I'm going to have better cardiopulmonary health. I will have better control of my blood sugars. I will have a better, more managed high blood pressure. Well, I don't have high blood pressure, but more managed blood pressure. So doing all of these things, implementing this, and also your kids are on top of you. For those of us who have kids at home, they're watching you. They're watching everything you do all day, every day. Count on it. I can guarantee you they are watching you. So they will watch you either cope by drinking, they will watch you cope by smoking, They will watch you cope by getting angry and having more arguments in the household, or they will watch you cope by doing positive things. You know what? Instead of baking today, which I love, don't get me wrong, we have had a number of chocolate chip cookie batches in my household. I'm not even gonna lie about that. But instead of that, you know what? Let me teach you how to fry an egg. Let me teach you how to, make up a little healthy scramble. Let me teach you how to bake something healthful like baked chicken or make some vegetables. Here's how you steam vegetables. We are teaching them every minute of the day, and they learn by modeling. They model their behaviors after us. So we're setting them up primarily for how to cope with things in the future, right? So it's not necessarily that we have to hide these things. Don't hide your drinking. Again, what we're teaching our kids is like, hey, this is a means to cope, or you know what, this is just something I enjoy. I like my glass of wine, and there's certainly nothing wrong with that, and I drink within reason. So again, there's different ways of really approaching this. Coming back to what I was talking about our elderly population, our chronic illness population, please, if you know anybody who has a chronic illness, make sure that they're doing their follow-up with their doctors, okay? Whether that's coming into the office or whether that's doing a telemedicine consult. And I can honestly tell quite a lot about a patient just by looking at them across the screen. Now, there's often times, and I would much prefer to put my hands on a patient, actually physically examine a patient. But if I just need to go over diabetes numbers with them and we need to look at some charts and see what their blood pressures have been for the last week and a half, that in itself is a huge step. It keeps us accountable. It keeps us on top of things. It reminds patients like, oh, that's right, I need to go to the pharmacy. I need to call in that prescription. There are so many mail order prescriptions now, so there's really no excuse for us not to be able to stay on our regimen. Make sure that you are checking in with your doctor. I cannot emphasize that enough. And if your doctor's office is closed, then please find a private practice near you, whether that's a concierge practice, a direct patient care model. There's a lot of different folks out there like me. I am happy to see somebody in the interim, right? If you can't get into your cardiologist right now, I'm not going to tell you that I am a cardiologist, but can I look through your medications? Can I check your blood pressure for you? Can I calibrate your machine versus our machine? I can do all of those things for you. We can run an EKG here. So there's a lot of things that I can help you with in the meantime until we get back with that trusted provider who you've been seeing for a number of years. And I absolutely encourage that. But you have to make sure that you're following through on your health first and foremost. Coming back to, again, other ways that we can support our health, do that detox that you've been waiting on. Who cares if you have a headache for the next 3 days? Again, I'm not really looking forward to that. I'm not excited about that. I don't like that nausea and the headaches from, detoxing. But if you've been waiting because you're like, no, you know what? I always have like a plane to catch every week. I'm doing this. I'm with the PTA. Guys, your calendar's clear, right? You're not going anywhere. So you may as well do that detox and do a good 14-day detox if you can. Do it with the family. Again, your kids are learning from you. Are they going to be harmed by it? Certainly not. Again, would I recommend doing like a 7-year-old detox? No, not in the slightest. But what we will do when we are doing a detox is we're going to have healthier foods in the house. We're going to be eating broccoli and asparagus and carrots and things that are good for us, whole foods, real foods that your body can recognize and process. So there's a lot of things that you can do from that proactive standpoint, from that empowering yourself standpoint, that will not land us into one of these statistics. And that's what's so huge. Now, I haven't talked yet about number 10 on the list of most common causes of death in the United States. Super, super important to talk about right now, and that is suicide. Suicide is huge, 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 huge. We lose 47,000 folks a year on average to suicide. We know also that suicide is increased by things like anxiety, depression, loneliness, isolation. Is this ringing a bell with anybody? Kind of what this whole lockdown has caused for people? Feelings of hopelessness, feelings of not being able to get out of the situation that you're in, right? So this is a big deal because we are potentiating all of those emotions with this lockdown. We're potentiating all of those emotions that will then feed into the susceptible population who is at risk for suicide. Now, granted, if you're otherwise fairly emotionally stable, do we go through a period of depression and feeling anxiety? Yes, that's very common. Again, I'm dealing very closely with a mom-daughter team right now, and she's like, "Gosh, I'm so anxious about all this." I'm like, "Yeah, of course you are. I would be surprised if you weren't." Absolutely, when you're going through a health challenge, there is anxiety. That's expected. But for those individuals who struggle with anxiety and depression as their baseline, are at much higher risk. Those people who struggle with substance abuse as a baseline are at much higher risk of slipping into that addiction and potentiating the risk of suicide. Those people who have lost their jobs and maybe don't have any ability to go back to a job, right? It's one thing if you're, some employable type of profession, right? So nurses who have been laid off, obviously, like nurses are not going to be laid off for long. There will always be room in the field for nurses somewhere. So those types of position. But if you have a very like micro kind of specialty of some sort, if you're sort of at a more close to retirement age, I just had a 65-year-old gentleman yesterday who got furloughed. He's like, I mean, forget it. I guess I'm just going to retire. Right. So he's fortunately in a position where he's able to do that. But if you weren't, you were planning to work 10 more years, there's a lot of discussion about how do I get back into the workforce with a new company, a new job, when you're at that age bracket. So again, these folks are being put at an increased risk of that hopelessness, of that despair. So something we want to stay tuned into with those folks that we know who may be at greater risk for that. So let me take a look at one of our, what's the relationship between underlying conditions like diabetes, heart disease, GI disease, and immune function? Doesn't this impact how a patient would respond to a virus? Absolutely. And that's kind of what I'm getting to with a lot of words, is really our overall general health will play into our overall immune strength. Okay. So if you're struggling with diabetes, if you're struggling with rheumatoid arthritis, with heart disease, there will be a fair amount of inflammation already. Your body is already on high alert. It's trying to fix these things all the time. It's busy. It's busy. It's busy. It's busy just with you sitting on the couch. It's trying so hard to maintain its health. And it doesn't know how to because we haven't given it the right tools, right? So whether that's a vitamin or a micronutrient deficiency, or whether we're bombarding it with sugar, because our glucose is out of control. Again, not necessarily that you're eating a sleeve of Oreos, but that you've just fallen off of your medications, right? Because it's a disease process, not necessarily what you consume. So that being said, you're at a baseline inflammatory process over here, which leads to what? Cytokines, which then leads to the potential for cytokine storm if you have just one more thing come in. It's always the just one more thing. It's that straw that breaks the camel's back. So if we're already busy over here, our body is not as equipped to be able to take an eye on that virus or a bacteria or any other kind of offending agent and be able to shield it appropriately, fight it appropriately, and recover from it appropriately because it's so busy over here. It has like nothing left to treat over here. And so that's what we want to be very careful with managing these chronic disease processes so our body is able to then fight and attack should it be exposed to COVID or any other virus, right? Not only be able to fight it, but prevent it altogether, right? Just say, no, you don't fix here. So if we have good mucosal lining, if we have good gut health, it's going to look at those viruses and bacteria and say, you don't belong here. And I'm going to attack you before you can even set up shop. It's not happening. And so that's what we really want to see happen. And that's why it's so imperative that you take care of those chronic disease issues and make sure that they're well maintained. Let's take a look. Children's mental health is so critical too. I think they're often overlooked. Schools catch these things sometimes, but they're closed. Absolutely. This is huge, guys. And I think that it's very eye-opening. So again, on a positive light, I think it's very eye-opening for a lot of us as parents when we are home with our kids all day and we're seeing how they're pinging all over the place and they're not really focusing. And we're like, oh, all that stuff that that teacher was telling me might actually be true. Oh, I thought my kid was doing better than this, right? Or we may have known issues and now we're having to deal with this on an 8, 12, 24-hour a day basis. We don't have that respite and those resources that are available within a school system to be able to send our kids and have that special ed teacher who is well equipped to address those special needs, right? We're now having to do it without the appropriate training. And not only that, even kids who don't have issues, right? I would say for the most part, my kids don't really have issues. I mean, they have their issues, but for the most part, like, we don't have any kind of diagnosis. Nobody's depressed. Nobody's anxious. That being said, they're struggling. They don't have their friends. They don't have their social circles. They're not playing, right? Play is huge. It is huge, huge, huge developmentally, just for them to learn how to interact with others, to build their physical strength. There's so many benefits to play that they're now not doing because they're not around their little friends. They can't go to parks. I mean, we threw sand in one of the parks out in Venice or wherever it was. Like, are you kidding me? Right? So these kids can't exercise. They're not getting the sun. They're not getting the fresh air. And then we're so busy caught in our own heads. Oh my gosh, how am I going to pay the mortgage? How am I going to pay the light bill? This thing came due. I didn't get a deferment on this. I never got my loan from the bank. I'm not getting my unemployment. We're so caught up with all of that. Have you checked in with your kiddo? Have you turned around and said, hey, how are you doing? Are you okay? I know you miss your friends. And it's so important that we check in with them because, again, they're little versions of us, right? They're learning and modeling after us. So they're going to see how we're responding to stressors, and then they are equally going to express certain things as stressors. They're going to have more defiance, possibly. They're not going to sleep well. This is the big one with my 12-year-old. She's up till 2, 3 o'clock in the morning, not even on her phone. I don't know what she's doing. She's just up, and again, that differentiation of day and night. Eating habits have changed. It's just there's a lot of factors there that we need to be sort of sheltering our entire family and really touching base with them about how all of this is affecting them on a number of levels. It's not just about COVID, guys. So much more here than COVID. Let's see if there's any other comments. I think that's about it. I know this was kind of a really heavy discussion today. It's something that we don't really like to talk about, but it's so important that we do. Some tips, again, exercising at home, doing your box breathing, eating more clean. There is no reason not to, right? Especially if people aren't hoarding. What was fascinating to me is that like all of the top ramen aisle was gone, all the canned foods were gone. This is kind of in the beginning stages of things. Fresh fruit, vegetables. Nobody touched the broccoli. Nobody touched the fish. Like, are you kidding me? If there's anything more healthy that we can put in their bodies, is fish, and fish for days, right? So really important to make those good food selections. You're going to feel better for it. Your body's going to thank you for it. You'll have better sleep. You'll have better overall emotionality just because you're maintaining your gut health and so forth. Stay on your medications. Follow up with your physician. Okay, do all of those things. Super, super important. And then check in with those other people that are in your life who are so important, and make sure that they're doing okay, and really get down to it, right? Identifying emotions is huge. Just calling anxiety, like anxiety, I see you here. I see you're in the room and you make me uncomfortable, but I know what you are, right? And I can handle you. So just doing those steps alone, I'm angry, I'm sad, I'm discouraged, I'm hopeless today, but I mean, it's not the end of the world. This is just today. The sun will rise tomorrow. So all of those things, just being able to identify what you are feeling is huge. And it's really critical. And then being able to communicate with one another. So rather than just having like butting heads and people just arguing and fighting, if you really identify that emotion that's behind it, like what is happening with you? You seem really sad, or you seem really frustrated today. Well, yeah, I'm frustrated. I couldn't find my homework. I've been looking for 6 hours and now everybody ate my ice cream, right? Okay, so it doesn't have anything to do with the ice cream. Right? It doesn't have anything to do with my kid being upset with me per se. It has to do with the frustration and anxiety of trying to get something else done that she's then finding limitations to and a struggle with. And it comes back to that. Now, I'm going to say that not every discussion in my household ends that way. I would love to say that it does, but we're all works in progress. So do the best you can with these tools that I've given you. Hopefully it'll be a big help. And let's see, nutrients and eating. What ingredients are the foundational for wellness? Not necessarily just virus focused. Again, what I usually focus on is to make sure you're eating foods that are recognizable to our bodies as food. So whole foods, fruits, vegetables, whole grains, unless you are otherwise barred from those because of food sensitivities, and lean proteins. And primarily, if we could, it's like plant-based diet where 90% of it is plant-based, and about 10 to 20% is protein-based or lean protein like meat, fish, chicken, right? So what do I mean by foods that are recognizable to your body? So if we're eating things that you have to crinkle out of a package, or you have to peel back or get out of a can, or you're getting through a drive-through window, then it is probably not food in the natural sense of the word that our body then recognizes and say, hey, hi, nutrients, I see you. And then it kind of sucks them all in and absorbs them and distributes them appropriately, right? We're eating processed sugars and fats and all sorts of dyes and who knows what. I mean, just take the back of an ingredient. So they always say in Weight Watchers and all these other programs, make sure you read your labels. Read your labels, read your labels. You have to know what you're putting in your body. I think that's important, but really fundamentally, if you think about it, there's no label on an apple. There's no label on a carrot. There's no label on broccoli. Why? Because they are natural, whole foods, right? When you're reading a label, you're reading about all the other chemicals that are then going to come together and give you a certain number of calories and fat and sugars, carbohydrates, right? But your body still doesn't see that as food. It's just like, what was that? You said I was supposed to get something nourishing, but I didn't find it. So then your body's going to go and seek and look for something somewhere else. And that's when you start to eat again and you eat again and you eat again. It's because your brain is saying, like, look, you told me you're feeding me. I don't see it. So it really needs those nutrients in order to stay whole. Now, if you can't, right? Again, some of us are still working full time, especially like our truckers that are out there. Go team. I love you guys. Healthcare workers who are on the front lines and they're not able to stop for a second. They've got all their PPE on. They can't eat. Take a multivitamin, right? And again, I love Mitocore. That's the one that I use personally. It's a fantastic multivitamin. It's got a lot of mitochondrial reset things like N-acetylcysteine and phosphatidylserine. Here's my geek showing again, right? So I love all of that stuff. But for heaven's sake, if you can do nothing else, take any multivitamin, right? You don't have to get it from me. You don't have to get it from a certain brand. I love my brand because I've like fact checked it and looked into how like well it's put together. But any is better than none. Okay, so if you still really can't stick to a reasonable dietary program or nutrition program, fine. Again, do the best you can every day. Every meal is an opportunity. But then certainly go forward and take a multivitamin so you are getting those baseline nutrients into your system so your body's not continuing to seek. And that's going to be huge. All right. And is there a need to supplement too if you're trying to eat clean? Absolutely. So again, as much as we would love to say, like, if you just eat broccoli and chicken breast for the rest of your life, you're going to be super healthy. Not the case, guys. In fact, actually, the more diverse your food selections are, the better your gut health will be. So again, coming back to the necessity for probably some probiotics, even for the best, cleanest eating of us, we still need to kind of support those bacterial colonies. You want to have some short chain fatty acids in there to help with that gut lining repair, appropriate absorption, so we're not leading to leaky gut, inflammatory processes, right? So these things are all super important. And again, oftentimes we say, oh yeah, you can get this from broccoli and you get that from asparagus and you get this from carrots. That's great. But really, if you look down to it, you're going to have to eat like 4 pounds of it to get the amount of whatever nutrient it is to get your body up to speed. And again, if you're not absorbing appropriately, right, then it doesn't matter how much of that stuff you're eating, your body's still not going to absorb it appropriately. So you're not going to get those nutrients into your system that you need. So supplementing with either a multivitamin, probiotic, short chain fatty acids, super, super critical to getting your body up to speed and where it should be. Okay. So I hope this really helps you. I hope that this kind of rings a bell with some of you where you're like can kind of redirect. And as we're starting, and then I feel like we're in sort of a transitional phase right now, that some of us are sneaking out of our hidey holes and we might feel guilty about it. We might be just throwing up our hands saying, I don't care, I'm going out. Again, there's reasons why we need to go out. Please be respectful for others. Certainly, if it's something that you don't agree with, then just suffice it to say that you don't agree with it and you want to stay home. That's okay. If you have to go out because you have to work to feed your family, hey, then that's okay. I can't walk myself in everybody else's shoes, so I'm going to assume that you're making the best, most well-educated decision that you can for yourself and your family with the information you have at this time, and you continue to do so. So stay healthy, stay well. Make sure that you subscribe and click notifications so that you can get alerted whenever we're having a new video. And I'd love to hear from you soon. Take care.